Hello and welcome back to another episode of Healing Our Community with Dr. Ray and Jean. Hi, I'm Dr. Ray.
And I'm Jean.
And this is Jenni Neil. She is with HopeWest. Yeah, we wanted to, before we get into, Jenni and what she does for HopeWest, we wanted to remind you that this is a live podcast. It is broadcasted on our Facebook page and our YouTube channel, KBH Center. If you have any questions or comments while we are having this conversation, feel free to put it into the comments and we'll be able to see it in real time and be able to answer any questions you might have for us or for Jenni. This podcast is aired every Wednesday at 12:15. So, Jean?
You know, the topic today is something that every single person will experience. Mm-hmm. None of us are getting out of this alive. And we experience it at so many different levels. Sometimes we are a family member, sometimes we're a neighbor or a friend, but we all go through this and it's not a fun thing to go through. But it's really important to talk about grief and loss and how we go through those things. In 2000, my dad, at the age of 60 years old, he had cancer, and I remember my family trying to deal with this. And my mom, she was only 58 at the time. She was really hanging on, and she wanted him to do this brain surgery that would have maybe prolonged his life for a month, but then he would have died probably more painfully from his lungs instead of whatever else was, getting him at the time. And I remember talking to the doctor, and the doctor was giving her hope, which is what doctors do, right? They have to, that's their job, is to give you your options and everything. And I remember, this was like we had phones, with cords, and I was on the other line at the same time. And I remember asking the doctor, is hospice reasonable? And because I asked the question, he said, yes, that's absolutely an option right now. And my dad wanted it. My dad was ready. It was my mom that was really hanging on. So it was a really difficult thing. And I think that's one of the most important things about hospice is, how do you know when to get involved, and how do you know all the things they can do to support you through those difficult times?
Yeah, before we went live, I was telling you, Jenni, that that was back in Chicago that we had that experience, mm-hmm. and that hospice experience didn't have half the resources that HopeWest does. Right. And I just wanted to thank you, Jenni, for everything that you're doing, and maybe you can talk a little bit about HopeWest, the mission, and how hospice is approached here on the Western Slope. Well, I guess all throughout Colorado, right? Yeah.
Western Slope.
Western Slope.
Absolutely.
Okay.
Yeah. Awesome. Well, thank you, first of all, for having me today. It's my honor to talk about HopeWest services. I think it's important to talk about, you highlighted something very important. We have that option to mm-hmm. advocate for ourselves and our loved ones for that hospice care. That's a little unique in mm-hmm. healthcare. We don't have to wait for that specialist to refer. We can refer ourselves. Like you said, HopeWest serves the Western Slopes so very well. We've been here for 35 years.
Wow.
Our communities have become accustomed to the absolute wonderfully thorough care that is HopeWest. We are most known for hospice. We do also provide PACE, palliative care, dementia support, bereavement support. We're very proud of all of those programs.
That's just a wide variety of support. Maybe you could talk a little bit about the misconception of hospice and kind of what it is.
Yeah. Absolutely. I myself didn't really fully understand mm-hmm. When I came to work for HopeWest in 2012. I was so grateful for the education that I learned more about what hospice care. Many people hear hospice and they think, oh, that's it. You have just a few days left. Mm-hmm. Hospice care is so much mm-hmm. more. Hospice care is it helps, it's that extra layer of support for patients, families, caregivers. They get to work with the interdisciplinary team that helps them not only with the physical symptoms, but the mental health issues, the grief and bereavement support, personally.
And quality of life.
Yes.
Yeah.
Yeah. We've seen patients improve, mm-hmm. even graduate from hospice, just taking that opportunity mm-hmm. to lean into hospice care. Some people hear hospice and think, oh, you expedite death. Absolutely not true.
Right. Yeah, I'm a volunteer. I'm also on the board of HopeWest, and I ended up being a companion for someone for almost more than 18 months. And I know for that family, she didn't have to go all the way to the hospital, and out here, the hospital's far away. It's quite a drive. So everything came to her, and so she was able to just reduce all that stress. Her family wasn't getting up in the middle of the night, and they had small kids to help her. So the care came to her, which I think probably increased the length of her life, probably by a year.
We hear that a lot. Patients are often just done. They're done going to the emergency room to get that acute symptom managed. They're tired of waiting in their provider's office. And like you said, hospice care, we go to them. They get to visit with their nurse regularly, their social worker if they want it, chaplain, even our providers, our nurse practitioners, and our physicians. We still work very, very closely with their primary care team, but time and time again, patients, families have shared. Even the fact that the medication's delivered to their door, they don't have to go to the pharmacy. It's just so very helpful.
And let's talk a little bit about caretakers, especially for dementia programs or those longer term things that there's no really clear future. And so they're waking up every day with that stress of taking care of someone that they love and care about and watching them go through really difficult things.
Yeah, the impact of mental health and on the entire family, not just the patient alone, is really kind of, our focus, and just how HopeWest is able to address all that. We talked about, before we went live, and that death is a process, right? And you mentioned that it was 18 months that you were a companion, for the person that was passing, and that's a long time, and it does take a long time for people to process death, go through all the different stages of grief, not just the patient themselves coming to terms, but also the family coming to terms as well, and rallying around that. It's not something that happens overnight. So I think that with all the different facets of support that you have, you're able to address all of those stages.
100%. Our interdisciplinary team of clinicians, we talked a lot about the physical symptoms, but the mental, it's a part of it. And so our team of, like I said, they can have access to our chaplain if they should wish, our social worker, of course, our wonderful grief counselors. They definitely partner with families, walk side by side with them, help connect them with maybe community resources. Let's help normalize this process.
One of the things that I hear a lot is someone passes, 3 months goes by, there's a lot of support during that time, and then all of a sudden everyone else is kind of getting back to their lives, and this person is really trapped in that grief, especially in a really long-term relationship if your partner dies, and that there's some expectation that they should be somehow getting over it in a certain time frame.
Yeah.
So what has been your experience with the longevity of people needing that kind of support?
Yeah, we have a wonderful grief and bereavement support department. Our counselors work with families after their loved one has passed. Coincidentally, you don't have to have a connection to HopeWest to take advantage of those services. So they do provide in-person counseling, group sessions. We have a specific program for kiddos, HopeWest Kids. We're very proud of that.
Yeah, and grief is a sneaky thing. It's been 26 years since my dad passed. And he pops into your mind sometimes in the strangest ways, especially for me when I was hiking that golden staircase in California. I was pretty close to heaven there. It was like, and all of a sudden, you could feel that presence or support. And our spirituality, which is where that connection is, doesn't have a relationship to time. So sometimes you can feel that grief as though a day has passed, even though it might be 3 or 4 years. And that's a really difficult thing. And I just want to normalize that for people that are experiencing grief, that it doesn't follow a line or a pattern. It doesn't just heal and get better and then you're done. That's not been my experience.
You know, one of the statistics I heard from Delta Health is that the average age within Delta County specifically is going up. And so I was wondering how that impacts HopeWest. Obviously, you know, then your program becomes even more needed.
Yeah, you know, it's amazing when you think of hospice. You know, Medicare says it's 6 months, the last 6 months of a patient's life. Well, I don't know about you, but I don't have a crystal ball.
Right.
So we encourage people to think about hospice sooner rather than later. Truly, truly. If you're diagnosed with a serious illness, and people often think, oh, you have to have cancer to qualify for hospice. That is not the case.
That's good for people to know.
Yeah, yeah. So you talk about the older demographic. You know, we do encourage them to call us, reach out. Maybe hospice isn't the program for them, but maybe one of our other service lines could be helpful. We love to partner with our community clinical partners as well. There's a lot of options here in Delta and Montrose County that we want to make sure that our community knows about.
Yeah, that's one thing I would say is that the sooner you connect with someone who has much more experience going through something like this than you do, right? If it's in your family, you're not doing this all the time, hopefully. It's, you know. And so even if you're having a conversation with someone, an intake person at HopeWest, and they help direct you and guide you through that process, it might not be time yet, but at least you'll have that information and you'll know what is available to you. And I think that's the biggest mistake people make is they wait way too long and they wait until they're really burned out and kind of at the end of their rope before they seek services, and it can happen so much sooner.
Yeah, we love to say know us before you need us. You know, the HopeWest clinical team, they're fantastic. We see them do just amazing care, sometimes in the last moments of a patient's life. But if we're able to get in sooner, or able to help the patient, of course, the family, the caregiver, prepare. It's really important to talk about. Don't feel like you have to have it all figured out. I don't know about you, but I've been there personally. You don't know what you don't know. No. And so we just encourage, call us and we will help walk you through. Maybe it's not time yet.
Right.
And that's okay, but call us and we can get the conversation started.
Can you share about how did you get into doing this work and why are you passionate about it?
Yeah, well, that's a good question. I came to HopeWest in 2012. I was really interested in working for an organization that was community-minded, and I fell in love with the mission. I fell in love with the people. I truly am honored to work for HopeWest. They truly care not only about the patients and families we serve, about their employees.
And what was your role when you first started?
Oh, when I first started?
Yeah.
I started as a team assistant.
Okay.
Yeah.
And now Vice President of Regional Operations?
Correct.
Is that what it is, the
VP
title?
of Regional Operations. Yeah, I get to work with our wonderful clinical teams in the Delta and Montrose areas.
I don't think there's anywhere that I've been in Delta County where I haven't heard the name of HopeWest and directly impacting some family's life. And that's a really big thing to have in our community where there's not a lot of services for everything that's out here. And for you guys to have this such a well-running machine to help people through the most difficult time of their life is really awesome.
Yeah, I love to talk about our HopeWest Kids program. We just had Camp Good Grief last weekend right here in our backyard.
And where's that held at?
At Camp Cedar Edge.
Camp Cedar Edge, okay.
Yeah, and again, you don't have to have a connection with HopeWest for those kiddos to participate.
And what you mean by that is you don't have to go through the hospice care before end of life, because the end of life might have happened in a different way, like a car accident or something else, but you're still grieving and you still need that support.
Correct. Yeah, in fact, Our grief counselors are present in many of our local schools, facilitating grief groups, and there may not be any HopeWest connection. It's simply the right thing to do for our community.
Now, you mentioned Medicare, and part of the mental stress of end of life is the financial stress that's put on the families. Right? How does HopeWest help families kind of navigate all of that?
I'm glad you asked. It is a huge stressor.
Yeah.
Medicare is just one of our payer sources, right? And there's a whole thing about payer sources and insurance. So let me just make it simple. HopeWest provides care to anyone, regardless of their ability to pay. How, you may ask? Through the generosity of our community. Yeah.
And there's a lot of things that are not paid for by insurance. And I remember my person saying that, like, where are all these diapers coming from?
Right.
Like, that's not covered.
Right.
But they show up.
Right. Yeah. And I've found that to be a hesitation from some folks. And that's why I say, give us a call. We'll talk about it. We'll walk you through it. It really is a wonderful benefit for our community that I can't say enough about.
And I've heard you say, in multiple talks that you've done and everything, is just, if you have any doubt, pick up the phone and ask. You don't have to be terminal.
Right.
Just call, talk to us, and we'll help you navigate that and make the best decisions and guide you into what programs might be a best fit.
Absolutely. Yeah. We're here to partner with the caregiver to help. It can get really overwhelming.
Yeah.
And you feel like you're in it alone.
Yeah, very isolating.
Yeah. Being enrolled in a HopeWest program can help. We've got professionals that can help. Maybe it's just normalizing what you're feeling. Or maybe they're going to give you ideas of other options, other resources.
Can you tell us, if you have the numbers on the top of your head, how many employees and how many volunteers?
Absolutely. We have about 450 employees across all of our service areas.
Wow.
Yeah, and then almost 1,100 volunteers.
And when you say 450, is that the whole Western Slope?
Yep.
Okay.
Yep. Grand Junction, Meeker, the Plateau Valley area, of course, Delta, Montrose. We go up into Ridgeway, Uray.
Wow.
Yeah.
Okay.
So one of the things that's really good for our mental health is that volunteering piece and being a part of something. And there's so many different opportunities and ways to get involved, like heirlooms.
Right.
You don't have to have any contact with patients in order to volunteer and be supportive. Some people come and do clerical work. What other kind of things can people do through volunteering?
Oh, you name it. We have musicians, we have hairdressers, massage therapists, event volunteers, floral designers. Yeah.
Wow.
Yeah.
I didn't know you
There
had
is-
musicians.
I know, there's literally something for everyone.
Which is really good for us to be connected and involved in things, and especially for something we're all going to need one day.
And I don't think everyone knows that Heirlooms is connected with HopeWest,
Not necessarily, but yeah.
right?
And there's one in Montrose, Delta, Grand Junction.
Correct.
Yeah. So there's just a wide variety of services and facets to the company, to the organization.
So just a little bit more about heirlooms. You can donate things to heirlooms, and you can go and buy things, and that money directly comes back and supports the people that are using hospice or other services.
Correct.
So, when it comes to mental health and all the different facets of it surrounding the death and dying, right, in hospice care, how do you guys approach that? And like, what assessments do you do? Or, how do you determine what kinds of services someone needs?
Yeah, absolutely. Great question. So our clinically trained nurses and physicians, they have what we call the criteria. And so they meet with the patient and the family, they review medical records, and then they go from there. And that helps them determine what is the most appropriate program for them. They may even reach out to the patient's primary care provider. And it's fluid. So maybe they're not quite appropriate for this program. We will do our best to get them. Maybe it's palliative care. Maybe they are fighting a terminal disease, but they're still seeking treatment, chemotherapy, what have you. Palliative care would be a good fit for them.
Can you explain palliative care?
Yeah.
Because I don't think people might know what that word
Yeah.
is.
At HopeWest, palliative care is, we check in on them weekly. They have access to our 24/7 triage system, the same that our hospice patients would call. They have that interdisciplinary clinical team that is built a care plan for them. It's not as maybe robust or frequent as a hospice care plan, but they absolutely still have a nurse that will come visit them. They'll check in weekly.
So this is someone dealing with a long-term illness, but not necessarily end of life.
Correct.
Okay.
Yep.
Okay. So yeah, caring, for their needs and not as robust as you said as hospice. Right?
The advantage is the patient, the family, they get introduced to HopeWest, to that amazing clinical team that I love to speak about. So when the time does come for them to transition to maybe hospice, that familiarity is built. They have the trust in the clinical team. It's just an easier transition for when it's time.
Can you talk about the companion program? That's something that didn't exist in Chicago in that hospice program.
Yeah.
And
In Chicago, it's very difficult to volunteer. You have to go through background checks and all sorts of things that, because it's small town, you don't have to deal with. So there is not a lot of volunteering in Chicago. So we didn't have that.
I love to talk about our volunteers. They are the heart of our organization. And that is one component of it, those patient care volunteers, we call them. It can be life-changing for the volunteer as well, as Jean spoke about. Again, our really well-trained volunteer coordinators, they lead that charge in helping connect the volunteer who has expressed an interest in companioning with a patient or family. And then the clinical team will bring those needs. The two will meet, and from there a match is made. Maybe it's respite care. Maybe the caregiver needs a few hours to go run errands. That patient care volunteer can come in and help fill that need. Maybe it's a life story. The patient wants to share about their life. A patient care volunteer can come in and document that life story. Yeah, it's really amazing.
it's very powerful.
Yeah.
Yeah. We asked, we had interviewed Quinn, in the sheriff's office, and one of the questions we had asked him is that if you had a magic wand and everything can be exactly the way you want it to be, coming from the sheriff's office perspective in Delta County, what would that look like? And so, the same question goes to you. Magic wand, everything is exactly the way you want it to be from a HopeWest perspective in Delta County, Western Slope. How would that look like for you?
Easy. More people would know about the wonderful programs of HopeWest. More people would feel empowered to call us so that we could interact, impact quality of life sooner.
Yeah, especially not being afraid to call. Like, I think maybe you'll think, well, I don't need it, or I'll be a burden or something, but that's absolutely not the case. The sooner you call, the more services can be put in place to make it easier on everybody.
Right.
That's
Yeah.
awesome.
Yeah.
If any of you have any questions, please put in the comments here. But I wanted to ask Jenny, is there anything else, any other facet of HopeWest that we have not touched on? We don't really know everything, and we've been involved with HopeWest for a bit now. Is there anything that we've missed?
Oh, we didn't talk about Spoons, the restaurant in
Yeah.
Grand Junction.
Oh,
that is
yeah.
Absolutely
that's right.
amazing.
Very delicious.
Yeah.
Yeah.
No, truly, HopeWest is such a beautiful, robust organization. We really do, like I said, we're most known for hospice, but that's not all of who we are. In our Mesa County, we offer PACE. That's a really important piece.
And PACE is?
program of all-inclusive care for the elderly.
Okay.
Yeah.
So that provides rides to doctor's appointments. What else do they do?
Yeah, it's a really, really robust program. They have a day center in Grand Junction. For more information, I would encourage you to call to see if that's an option. Our dementia support program, we're a year old on that. Wonderful option for those patients and caregivers navigating dementia. Even if you don't have an official diagnosis, call us, let us walk you through it. Of course, we talked about palliative care and then hospice.
Fantastic.
Yeah.
If anybody has any questions, about HopeWest, what's the best way that they could reach out?
Yeah, check out our website, hopewestco.org. You can call any of our offices. If we're speaking about Delta County, it's 970-874-6823. And we can get you wherever you need to go from there.
Fantastic. That's awesome. And, just kind of on a personal note, I want to let you know, Jenni, that that you were one of the people that kind of inspired us to open up KBH Center, just so you know. We've had some conversations and stuff before. We developed our mission and how we wanted to help Delta County. So we want to thank you, for being one of those inspirers. So.
Well, we're glad you're here.
Yeah. So thank you so much for joining us today on our podcast. This podcast was designed to engage in conversation and real talk about mental health, and mental health specifically, how it impacts our county here, Delta County, but also the Western Slope as well. We can't solve any problems, we can't find any solutions unless we have real conversations, and so let's keep talking.